This is an orthokeratometry case where the patient's worn lenses for several weeks now, but we can see that not much treatment is happening, getting what looks like is the early starts of a post-wear Ortho-k topography, but it's not very distinct, and the patient's not getting very much correction to myopia. So if we bring up the lenses, this is what the patient is using currently. The corneas are kind of flat to begin with, but we're not correcting very much myopia here, so it should be a doable case. I think freeform is fine for this patient since the nasal and temporal aspects of the cornea look fairly asymmetrical. In the left eye, there's a little bit of lack of homogeneity to the base curve, and sometimes that happens if you switch from GSIM to freeform. Just keep in mind, anytime you make changes down here, you don't want to just click the box. You should go through the tools and configuration settings. Changes up here can be done manually, but it's best to have a way of redesign a lens if you're going to change from GSIM to freeform or RSIM to GSIM. A couple other things I would change with this lens are to go a little bit bigger, measure this cornea pretty close to 12 millimeters, maybe 11.9. So I think we can go to about an 11.7. That should help stabilize the lens. We can thin the edge a little bit and increase the center thickness, give us a little bit more push. The thinner edge will get that lens to perhaps seal down a little bit better. And then I'd also reduce the OZ and IC position. We're I think 6.2 and 6.8 right now, and we can bring that down. I like to go with the 5.6 and 6.2. And then possibly increase the topo demand a little bit since we're not getting very much treatment. So since we're making a whole bunch of changes, let's go ahead and go into the configuration settings. So 5.6 and 6.2 for OZ and IC placement. Afocal clearance we're set to about 7. Edge thickness will decrease, center thickness will increase. I think I'm going to go with about 1.4. So 1.5 is going to be closest, and we can tune that up a little bit at the end. And our diameter will be an 11.7. Okay, freeform. I'm going to leave the blending on. I do like to use prism in all my freeform lenses, and this is not really for the fit of the lens. It's just for me to be able to leave the lab a note asking them to dot the lens at the prism ballast location. That helps me see how the lens is lining up. A freeform lens only works if it's exactly lined up the way we expect it to be. Even if this lens is 180 degrees off, like a soft toric, we're not going to get the results we're expecting. So I'd like to click that just to give the lab a place to dot the lens with a marking pen before they send it out to me. All right, so I'm going to let this run, pause the video in the meantime. Sorry, I had this box checked. There's actually an R that's cut off on my screen here. This should be the box you're checking. That's the freeform. So here's the new lens that we had kind of talked about. I'm going to bring down the topo demand just a little bit. And it does look pretty even all the way around. I'm also going to lift the edge a little bit. And this is just to make sure that the back edge of the reverse curve really bears down on the cornea and gives us a good seal so that we can ensure better fluid dynamics and better treatment. So I would go ahead and apply these changes to the left eye. I think we can use pretty similar lens philosophies, design philosophies for both eyes, and hopefully that'll get your patient on the road to better treatment. So hope this is helpful. Best of luck, and thanks for watching.